Perkins-OLOL in the house with Hurricane Betsy Barnes, and our medical segment is brought to you each week by Mary Bird Perkins, Our Lady of the Lake Cancer Center, and we are so excited to welcome Dr. Nick LeBlanc, who is new to the Cancer Center.
I am.
Thank you for coming
Thank
in.
you for having me on the show. I appreciate it.
But you do have those roots in Louisiana, so tell us a little bit about yourself.
I do. I'm from Lafayette originally, and my dad's from Erath. My mom's from a small town called Simsport, and grew up my entire life here. Ventured away for soccer and for education to South Carolina, moved back down for med school at LSU in New Orleans, went away to Virginia for a fellowship. I couldn't get enough of the mountains, so I went back. And then my fellowship carried me up even farther north to Canada to do a thoracic non-cardiac fellowship for a couple of years, and here I am.
So fresh all the way down here from Canada most recently.
Yes, yeah. Trying to get away from the snow.
Yeah, and just in time, right? You said
Yes.
you just came back in September, right?
I moved back in July and just started working in September, correct.
Awesome. So you got a little bit of time.
A little bit of time. Well,
to-
time off, it was board studying, so even though I wasn't working, I was still doing quite a bit of work.
I remember
so.
those days way back then.
They're never ending, right?
Right,
So.
for sure. So you're a thoracic surgeon.
Yes, ma'am.
And interested in lung cancer. What created your interest in that area?
Specifically, it was the idea that we have a lot of room to go in that field. With the encouragement and the education for the lung screening programs that we are starting and have been pushing and promoting, we're finding them earlier. So if we find cancer early, then we have a chance to actually do something about it, and that typically involves a surgical resection, and also being part of the forefront with the technology. So we're doing anything from endobronchial, so getting our diagnosis and staging things, meaning figuring out which stage it is. You can do that through the airway, or you do a minimally invasive surgery, and that's VATS or robotic, and that's something that we incorporated at Our Lady as well, Mary Bird Perkins.
And that's something that has really come a long way in itself, but it really has not been used for lung cancers because they're typically picked up in a delayed stage.
Correct.
And so I think we did talk about the screening offerings for high-risk individuals.
Free screening.
We're a lot of high-risk individuals in our state of Louisiana.
A lot, yes.
So it's a good place to be at. That's
Correct.
going to be at the forefront of that because we can probably help lots
We
of
can
folks in
help
the state.
Many people.
And I know, I think they said only maybe 2% of the people who really could be screened are currently getting screened, and so I'm glad we were able to get out that information. But let's talk a little bit about, once they do the screen and they find an abnormality, and it's in that early stage.
Yep.
Talk about a little bit more detail about those easier treatments when it's in stage 1.
Okay.
Or 2, most of them are stage 4, right? When they're
yeah,
picked
a lot of them
up.
are advanced, and so the 3 things that I tell my patients that we have to do anytime we're talking about cancer or oncologic procedures is that we have to diagnose it. So even though there's an abnormality, it may or may not be a cancer.
Right.
Then we have to stage it, and that involves specialized CT scans or even looking at nodes, because we know that lung cancer tends to spread to the lymph nodes and then
Right.
the brain and other sources there. So then the last thing is treatment. So with the multidisciplinary approach that we have at Mary Bird Perkins, where we're getting the screening involved from the primary care physicians, and then the multidisciplinary approach that goes with the medical oncologist, the radiation oncologist, us thoracic surgeon, our pulmonologist, that we can then start moving down that pathway of getting the diagnosis, being whether that's if it's close to the central part of the body, we can usually do that from the endobronchial region, meaning we go through the airway.
Right.
And we can biopsy it that way. If it's farther out, we ask our interventional radiology colleagues to do a percutaneous biopsy or go through the skin to sample the lesion that's in question.
And the great thing that is that all of these things that are less invasive, once there is a diagnosis and treatment, leads to quicker recoveries.
Absolutely.
Let's talk about that.
So that's the exciting part about moving from the big incision or the thoracotomy that we used to do. So
Right.
we make an incision this big to take
Halfway
out something
around your
this
body.
small.
Yes.
Right, exactly.
And that has been fairly recent. This is, the technology has changed in 15 years.
Correct, yeah. The minimally invasive or VATS, which is the video-assisted surgeries that we would do, that's even morphed into now with the robotic, which is still minimally invasive, obviously, but you have the
Right.
assistance of the robot. And so they're small incisions that you make. You do the procedure through these. You remove the specimen or the lung tissue from that wound. And patients go home in 2 to 3 days on average.
2 to 3 days, that's
Which
wonderful.
is incredible.
Compared to a week's long stay for a thoracotomy and dealing with a lot of the post-op pain. And the other thing that we've done is we've incorporated this ERAS, or for thoracic surgery, it's ERATS. Not
It's
to be it's
ERATS.
ERATS. Not to be confused with ERATH, which is where my family is from, so they call it
Right.
ERAT. So it's ERATS, which is
Yeah.
enhanced recovery after thoracic surgery.
Okay.
And so it's a pathway that we have where we make sure nutrition is optimized. We get people involved with smoking cessation, because that's even key for regular screening protocols that we have from the NCCN and other cancer guidelines, that you need to stop smoking. Even if you can cut back, that's better
It's so
than
hard for
nothing.
someone that's a lifelong smoker. My mother actually had lung cancer. We went through 2 bouts of lung cancer,
Yeah.
and then it overtook her. But the stopping smoking was the absolute hardest thing, and she just was not able to do it. And people don't realize you have to do it. To preserve your life, you have to do it.
And it truly is. We understand that it's probably the most difficult thing that we ask patients to do, because, think about it. If you're drinking or doing something illicit, you only get that a few hits of that at a time. Whereas with cigarettes, you're taking multiple hits per day, a pack or 2 packs per
Right.
day. So you can imagine that's every hour or so that
And
you're
we have a
getting the
lot of
nicotine.
smokers, and many who are overweight in our state, who don't have great health habits, and this might be the scary beginning of a change for their health to improve drastically.
Right.
Well, and for recovery, even if it's not a lung cancer, certainly, it's going to reduce their risk if they can stop and they don't have it. But even once they're recovering, you just don't heal as well if
Right.
you're a smoker. And a
Absolutely.
lot of people don't realize that. Even when they're coming in for some other kind of surgery, they just don't heal and recover as well.
It's vital to cut back and stop, obviously, because the blood vessels get constricted or narrowed, and there are plastic surgeons or other surgical procedures that you won't operate on if someone is continuing to smoke, because they won't heal very well. And with the other field that goes into thoracic oncology surgery is the esophagus, and you also see a lot of esophageal cancer with the drinking and the smoking. And
Yes.
so these are other things that we address and we deal with, and you're right, it's getting people to cut back and stop if possible.
And then you
Yeah.
have the wrinkle, the new difficulty with COVID of people that might have lung scarring and some other issues as well. So it's
Right.
going to be very interesting discovering the best treatment options for those that have been through that.
Yep.
Well, before we tell folks where they can find out some more information, I want to know, what are you doing for Thanksgiving?
For Thanksgiving,
Yeah.
I will be working.
Okay.
I'm the new guy, so I
You're
get
the new guy, so you get all the
but
holiday
it's-
call, right?
Yeah, it's fine. I volunteered for it because my family's gonna be in Lafayette, and so they'll come up for that, and so that'll be fine. But I'll be on call working, and nothing too exciting for
Your
this
family is
Thanksgiving.
probably so thrilled that you are home now.
They are very pleased, and
Yes.
I'm happy to be back home as well. And my tradition with residency and even fellowship is we always had to work for Thanksgiving, so we would always do a Friendsgiving on the Saturday after Thanksgiving. So we'll be trying to do something like that this year as well.
That's great. We talked about Friendsgiving the other week with our folks at City Slice. I don't know if you've had a chance to
No,
go
ma'am.
there, but they had some great dessert pizzas and some amazing pizzas. They've even got some with some little animals on them, like rabbit.
Yeah, if you need
It's
restaurant
amazing.
recommendations, we can hook you up.
I would be more than happy to take a list of that because I've been making
So,
it as I've gone along.
What is one of the things when you were up in Canada that you miss most about Louisiana?
Or football, college football.
Yeah, that's
Oh, you're still missing that, right?
I am still missing it. No, in all
Everybody's
honesty,
missing that this
it's-
season.
right.
The farther north you go, that you realize that the food is not nearly the same. So I've missed the home cooking and just being around friends and family down here.
Yeah.
Speaking the same language.
As much,
Yes.
do they?
No, they don't. Even if I do it mild when I cook, because I enjoy cooking, and it's even dampened down as much as I can, they still find it a little bit too spicy for them.
Yeah, yeah. I had
There you
I
have
had that
it.
too, and I was only as far up as St. Louis, when I did cook some things.
One of the things that has always impressed me about Mary Bird is they really are just a big family. It's a big family atmosphere. All the interaction. We've had interaction with them for over 3 years, and we regularly meet different surgeons, different therapists. Some of the arts therapy programs that Kay's been involved with, music therapy programs, things like that. It's like a big family of people that just want to help each other. It's a neighborhood of its own, a community, and the people that you touch, as we said before, every single person has a cancer story. Every single person has somebody they've loved or love who is really facing some difficult times and needs to be uplifted, and Mary Bird always lifts people up.
And I think you hit the nail on the head with that comment, that it has felt like family since being there. And so they've welcomed me, and I welcome the opportunity to work there with them. So it's
We're so
fun.
glad that you took time and came on our show.
Thank you again
We've
for
been
having me.
talking with Dr. Nick LeBlanc, who is
LeBlanc.
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 Did I-
LeBlanc, say it correctly.
Did I say
LeBlanc.
it right?
No C, and you have to say it with a capital B in there, too.
LeBlanc.
LeBlanc.
LeBlanc. I hope I did all right. I'm gonna have to practice that. I know my husband always said I try to make that C, but I don't. Dr. Nick LeBlanc. Did I do okay? I want the
right.
check mark.
C'est bon.
That's right. Say bon.
Okay, so from one of the newest thoracic surgeons over there at Mary Bird Perkins, Our Lady of the Lake Cancer Center, if you want to know more information about their lung cancer screening or more about their thoracic surgery clinic, you can go to marybirdlake.org/lung. Got it right?
That's right.
Anything else?
No, ma'am. I think it's it. Thank you again for having me
All
on the
right.
show.
Well, welcome to Baton Rouge.
beans.
We look forward to seeing you
Yes.
around.
All
And
right,
we
thank
hope you have a happy Thanksgiving
Very happy.
and a quiet Thanksgiving on call.
Thank you. Y'all too.